quite recently, we have published a trial-level meta-analysis of more than 10 studies looking at HER2-positive, early-stage HER2-positive disease treated with neoadjuvant anti-HER2-based therapy, either anti-HER2-based therapy without chemo, just dual HER2 blockade, or anti-HER2-based therapy in combination with multi-agent chemotherapy. And the objective of this trial-level meta-analysis was to focus on intrinsic subtyping, and in particular in the so-called HER2-enriched subtype. The HER2-enriched subtype represents approximately 50% of all HER2-positive tumors. And previous studies have shown that if you have this particular subtype and you're HER2-positive, you have a higher probability of achieving a pathological complete response after neoadjuvant therapy. So in this trial-level meta-analysis, we wanted to review all the evidence so far and perform formally this meta-analysis that clearly showed, on one hand, that HER2-enriched is a consistent predictor of pathological complete response beyond other clinical pathological features. That was the first objective. The first objective was to show that the value of this biomarker, the HER2-enriched, is beyond hormone receptor status. So we perform a trial-level meta-analysis within hormone receptor positive and within hormone receptor negative. And in both groups, the HER2-enriched is associated with a higher likelihood of pCR compared to the other subtypes. We also explored the value of this subtype in the context of no chemotherapy. Several studies have now evaluated dual HER2 blockade, especially with lapatinib and trastuzumab. And again, we confirm the findings of the PAMELA trial, for example, that the HER2-enriched is a biomarker of response even in the absence of chemotherapy. So this is the study, the trial meta-analysis that we published in Cancer Treatment Reviews. Definitely, we need more evidence in the sense that I think the next step is to evaluate the prognostic value of the biomarker. Predicting pCR is great, but I think we need to predict survival. So I think the next steps and the next efforts will be to link this particular biomarker into survival analysis. And the other implication, I think, is that I think this particular biomarker has graduated and has shown enough evidence to be integrated in current and future clinical trials evaluating early-stage HER2-positive breast cancer.